Navale, and I am the chair of the APHA Student Assembly. I'm a doctoral candidate in the Department of Biostatistics, Environmental Health Sciences, and Epidemiology at Kent State University's College of Public Health. It is my honor today to welcome you to the National Public Health Week Public Health Student Day Google Hangout with the U.S. Surgeon General, Dr. Vivek and Murthy. Our moderator today is Tamar Klaiman. She is a public health trained researcher and educator. Her research focuses on the use of positive deviance methodology, in which she defines and learns from high-performing individuals, institutions, and organizations in order to share lessons learned and improve public health system performance. She studied emergency preparedness policy creation and response and the use of clinical disease registries for the purposes of public reporting, among other topics. She is currently an assistant professor of health policy and public health at the University of Sciences in Philadelphia. Dr. Klaiman received a bachelor's degree in international affairs from the George Washington University, and she also holds a master's degree in public health and a PhD in public health from Temple University. Welcome, Tamar.
Thank you, Suparna, and thank you everyone for joining us today. I am thrilled to be here. As a former Student Assembly chair, I'm very excited to support the work of the Student Assembly now, and I'm thrilled to have Dr. Murthy here with us today. So I'll take a moment and introduce him shortly. In the meantime, I wanted to, just in terms of some housekeeping issues, we received numerous questions prior to today's call. Some of them we will be addressing in today's call, and then any students who have questions while we're on the call can feel free to submit them in the chat box, and they'll be forwarded to us on the speaker side. However, while we've received so many questions and we would like to get to them all, we won't have time for all of them. So those of you who submitted questions who don't get them answered, please forgive us. We just won't have time to get to all of them today. I'm thrilled today to have the opportunity to speak to the nation's doctor, Dr. Murthy here, and I'll just take a moment to introduce him, and then he'll give us a few words and tell us about some priority issues from his perspective, and then we'll get right down to the questions. Vice Admiral Vivek H. Murthy was confirmed on December 15th, 2014, as the 19th U.S. Surgeon General. Dr. Murthy oversees operations of the U.S. Public Health Service Commissioned Corps, comprised of approximately 6,700 uniformed health officers who serve to promote, protect, and advance the health and safety of our nation and our world. For the past 2 decades, Dr. Murthy has devoted himself to improving public health. He is the son of immigrants from India, and he discovered a love for the art of healing early in his childhood while spending time at his father's medicine clinic in Miami. After earning his bachelor's degree from Harvard and his MD and MBA degrees from Yale, he completed residency training at Brigham and Women's Hospital and Harvard Medical School, where he later joined the faculty as an internal medicine physician and instructor. When he was 17 years old, Dr. Murthy and his sister co-founded Visions, an HIV/AIDS education program in India and the US, which he led for 8 years. He also co-founded the Swasthya Project, Health and Well-Being in Sanskrit, a community health partnership in rural India designed to train women to be health providers and educators. Dr. Murthy has also conducted research on vaccine development and studied the participation of women and minorities in clinical trials. He is a healthcare entrepreneur who launched a successful software technology company, Trial Networks, to improve research collaboration and enhance the efficiency of clinical trials around the world. Most recently, Dr. Murthy served as the president of Doctors for America, a nonprofit organization comprised of more than 16,000 physicians and medical students in all 50 states who work with patients and policymakers to build a high-quality, affordable healthcare system for all. Dr. Murthy, we're thrilled to have you with us, and please go to it.
Well, thank you so much. Let me just tell you how happy I am to be here with all of you, especially speaking to many of our students and trainees in the world of public health. I've been a big fan of APHA long before I was Surgeon General, and have had the opportunity to work with your leadership over the years. And this is a tremendous organization that does a lot for our community. So very happy to be here. Let me also tell you why I think that this is a particularly special moment for public health. You know, as I travel around the country as Surgeon General, I see that people are facing a lot of challenges when it comes to health. A lot of these are from chronic illnesses that we see and hear about: diabetes, heart disease, cancer, many of them related to or linked to obesity. But there are also new crises which crop up, which people worry about. whether it's Zika, which people have been talking about a lot these last few months, whether it was Ebola last year, or whether it's the prescription opioid crisis, which has been building for years and has really reached a crisis point. But what you find is that in some way or another, public health challenges touch the lives of everyone in America, and that makes the importance of public health leaders all the more critical. I think this is actually an incredible time to be in public health, because now, unlike any time in recent history, I think more people are waking up to the fact that public health is relevant, that it's important, and it's not only something that can't be ignored, but it's something that all sectors have to participate in. And that public health isn't just a department that sits off on the side, but it's in fact the foundation that makes the work of all other sectors possible. It's what allows us to thrive as a country. And as people see that, that makes the role of public health leaders all the more prominent and important. And that's why I'm excited that so many of you have decided to dedicate your lives to public health. I think this is going to be an incredible few decades that we have ahead of us.
Thank you so much, Dr. Murthy. I think that's very inspirational, and I'm sure that many of the students that are on today's call are just as excited as you about public health, which is very thrilling as someone in public health. So one question that came up multiple times in the questions that we received prior to today's call was focused on some of the challenges that you face in your role as Surgeon General. So could you speak to some of the biggest challenges that you faced and how you've overcome them in this role?
Sure. Well, let me just say that it is a real privilege to serve as Surgeon General. There are a lot of great parts of the job. Yes, there are challenges, for sure. But there are some incredible parts of this job. And one of the best parts of being Surgeon General is the opportunity to go around the country and meet people in communities and hear directly from them about what challenges they're facing and also what solutions they're trying to overcome those challenges. This is, I could sit in Washington, D.C., for example, and read as many briefing memos and briefing books as I want, but there is no substitute from going into communities and hearing directly from people. That's a theme I want to come back to a little later on in today's conversation, but that really is the highlight for me of this job. But there are challenges. And I would say that one of the biggest challenges of being Surgeon General is picking areas to focus on, because there are so many potential priorities. There's so many letters I get every day, so many calls that come into our office, so many requests that people make of us to tackle certain issues and to take on other public health challenges. And in an ideal world, we'd love to take on all of them. But I'll tell you something that most people don't know, which is that the Office of the Surgeon General is actually much, much smaller than you would think. We have probably about 24 staff, at a good time, and more. When I entered the office, for example, we had probably around the order of 10 to 12 people who are on our immediate staff. So it's a small group of people, and I tell you this because most people think that we have legions of people who are working in our office, combating all kinds of issues all over the country. It's actually not the case. So what that means is that we have to focus on setting priorities, and that is the greatest challenge in this office. I will tell you that for 2016, I can tell you the priorities that we've laid out, and I want to share those with you today. They fall into two categories. One is the category of addiction, and the other is around emotional well-being. Now, in the category of addiction, a term we use colloquially, but in terms of public health and medical folks, we use the term substance use disorders. But here we are going to be launching an initiative very soon around the prescription opioid initiative. We've done some preliminary events on that over the last couple of weeks and are launching a prescriber-focused campaign to change prescribing practices so that we can reduce the growing problem we have in America with prescription opioid misuse and dependence. We'll also be addressing e-cigarettes later this year in the category of addiction. And finally, toward the end of the year, we'll be issuing the first ever Surgeon General's report on substance use, addiction, and health, with the goal of bringing together the best available science on how to prevent and treat addiction and how to keep people in recovery. And we'll be also using that report to change how the country thinks about addiction. And many people think about addiction as a bad choice, as a moral failing. But we want to help the country see addiction for what it is, which is a chronic illness that we have to treat this with the same urgency and skill that we do diabetes or high blood pressure or any other chronic illness. This second part of changing how the country thinks about addiction is really important. And I want to tell you why. Because if we don't change how people think about addiction, First, it makes it hard for people who are living with substance use disorders to come forward and get the help they need. They feel like they're living with a certain stigma, that society looks at them in a negative light. Many times they don't want to come forward and seek help, and then all of us lose out. The second thing is it makes it harder for communities to support efforts to treat substance use disorders. One of the things that we have seen, and that I have seen as Surgeon General as I've traveled the country, is that there are many communities where people don't want substance use treatment facilities in their neighborhoods. And they don't want them there because they think that addiction is something that that only bad people suffer from, and as a result, they don't want bad people coming to their neighborhood. But they don't see that addiction is actually a chronic illness, and nobody would object to having a new center for heart disease in their neighborhood, or a new center for treating diabetes. In fact, we have more and more of those, it seems like, all the time in the country. So we shouldn't treat addiction differently. And part of our intent with the Surgeon General's report is not only to bring the best science together, but also to help the country see addiction in a new way.
Thank you very much. And certainly an issue that has been present in many communities for a long time and now really coming to the forefront. So I appreciate that your office is prioritizing it and addressing it in the way that you are. In some ways, it segues nicely into a question that Jacqueline Koenig had, and she says that sugar has been regarded as the new tobacco. The Surgeon General was instrumental in sparking anti-smoking efforts in the 60s. Do you think that the Office of the Surgeon General could play a similar role in tackling junk foods and sugary beverages, which some have seen as an addiction in its own right? What strategies would you advocate to improve Americans' diets?
Well, that is a great question, and it is a question we get often. One of the issues that is on our radar that we have been tackling this year, last year, and will be tackling actually even more in future years is the topic of nutrition. And one of the most commonly raised topics in the nutrition category is that of sugar. We know that as a country we consume a lot of sugar. In fact, about half of people in America right now consume a soda each day, and we know that that has detrimental effects. What's also interesting is not just the sugar that we know about, the sugar that we find, for example, in sugar-sweetened beverages. It's also the sugar that's hidden, that we don't often know about. Many people are surprised to learn that salad dressings, which you buy off the shelf and you think of as a savory product, can sometimes have a fair amount of sugar in them. People are also surprised to learn that pasta sauces, if you actually read the label, many of them have a lot of sugar as well. Sugar, it seems, has found its way into so much of what we eat, into bread, into sauces, into all kinds of products. And in some ways, this started happening more and more in the 80s and 90s when there was a push away from fat. And we decided that fat was bad and we needed to seek out foods that were low in fat. But they still had to be tasty because otherwise people wouldn't buy them. So instead what we found is that companies started taking the fat out of products and instead substituting with sugar and salt, which had its own cascading set of health impacts, contributing to our obesity crisis, contributing to hypertension and heart disease, and we're paying the price of that. So one of the principles that's important as we think about a nutritional strategy for the country is balance. We don't want to swing wildly in favor of one ingredient, now and then next year say, okay, that ingredient's terrible, let's go for another ingredient. There's no one magic nutrient that's going to solve all the healthcare problems that Americans face. But what will help us move forward is a shift and a push toward a more balanced diet. A diet, for example, that includes fruits and vegetables, at least 5 servings of that. Something that we've been hearing for years, but it turns out very few people are actually able to do in their actual practice. And balance also means moderating the amount of sugar and salt that's in our diet. Part of that is knowing what products have sugar and salt in them, which is not always easy, especially if you go out to eat, which is why people knowing how to cook and prepare food at home, making sure that restaurants actually recognize the importance of making nutritional facts available, making sure that restaurants buy into the idea that healthy and tasty foods are what are needed more and more for our population and part of their responsibility to provide to the community. These are all tenets, of an approach to nutrition that I think will ultimately help us move forward. But there's no magic fix to nutrition. It's going to require a lot of public education. It's going to require partnerships with the private sector to help change packaged foods as well as restaurant foods so that there are more healthier options available. And it's going to require cultural change as well. And let me just say a word about that. Because we talk in public health a lot about the importance of the environment, as well we should. We know that environment drives health choices. We know that if you, for example, live in a neighborhood where safety is an issue, then the likelihood that you're going to go for a walk after dinner is diminished. We know that increased parks and other green spaces in communities are associated with more people walking and being physically active. We know that being close to grocery stores that have healthy and affordable food makes a difference in the kind of groceries that you actually buy. And sadly, there are far too many food deserts in our community where people are getting their groceries at 7-Eleven and often primarily relying on processed unhealthy foods for their basic sustenance. So the environment matters, and part of our message as public health leaders has to be to help other sectors realize that they have a role to play in shaping the environment in a way that supports healthy choices. But environment isn't 100% of the equation, because the other half of that is culture. We can build all the parks that we want and sidewalks that we want. We can make all of the healthy and affordable food that people need available in their communities. But if people actually have no desire to walk, if they actually don't want to eat food that we think is healthy, it doesn't matter how affordable or available it is. It's not going to get consumed. And that's why part of what we have to do is think about how we shift culture. And culture are the collective preferences that a group has. So the question is, what shapes culture? And the truth is that individuals and community leaders and communities often have a big role in shaping culture. We sometimes think that, oh, it's media that shapes culture. It's what people see on TV and in the movies that shapes what they want. And yes, that has an influence for sure. We know that advertising also shapes what people want, which is why I'm particularly concerned about the advertising of junk food to children, because we know that that impacts their preferences and ultimately can lead them to eat unhealthier foods. But all of us have a role that we can play in helping to shape the choices that we and the people around us make. One of the very first stops I made as Surgeon General when I began my listening tour was in Birmingham, Alabama. And there, I remember sitting down with the pastor of a large church in Birmingham. And he said to us, he said, you know, we realized some years ago in our church that fried chicken, while it's a staple for many of us, was not necessarily the healthiest thing for us to be eating on a regular basis. So he said the church decided to lead by example because they recognized that they were a powerful cultural force in the community. And they made a shift to actually serving baked chicken instead of fried chicken. They didn't say never eat fried chicken again. They didn't say that to everyone. But they said, why don't we try shifting toward baked options instead of fried options? Now, initially, people were concerned. They're like, well, this isn't what we're used to. It doesn't taste the same. But eventually, actually, folks got used to it, and they realized, actually, this stuff tastes pretty good. And the pastor was very proud of that, because he said that through that step that the church took, they were able to help many families recognize that baked chicken could be a tasty option as well. And it helped shift their dietary practices. That's the power of what one institution did in one community. So you imagine as we go about the task of changing the environment and changing culture so that we can make healthier choices more possible and also more likely, we need the engagement, not just of traditional public health forces, but also of our faith leaders, of our business leaders, of teachers and schools.
Thank you very much, and you're preemptively answering a number of questions that students have asked, so so that's great. So building off of what you just talked about in terms of changing the environment and culture, we know that historically policies have also had a big impact on behavior and issues of environment and culture. And some of our students had a question about how we can overcome the political polarization that currently plagues our country in order to improve the public's health. So I'm wondering if you have any thoughts about how to deal with some of the issues that we have from a political and policy perspective to address things like environment and culture that you just talked about.
Well, this is such a timely question. When I travel, this is one of the things people lament, that they know that the needs that we have right now in our country are great, but they worry about our ability to come together and meet those needs. This is actually where public health, I think, has an especially important role to play. Health is one of the great unifiers. When you think about it, health is important to each and every person, regardless of their political beliefs or philosophical beliefs. We know that disease affects people of all walks of life in every region in our country. We're seeing that, for example, with the prescription opioid crisis, which has impacted people all across our country in urban and rural areas, across racial and economic lines. It's one of the reasons, actually, that in Washington you see people of both parties coming together to help solve this problem because they recognize this is impacting all of us. But the truth is, there are many health conditions that are impacting all of us: diabetes, heart disease, cancer. And the real question is, who can communicate to people and to our elected leaders and to others and bring about essentially this unifying element of health, but how health impacts everyone, and who can bring the country together around a unified health agenda? Well, I think that should be leaders in public health. They should be the ones who bring our country together around shared issues around health. And this isn't always how we've been trained. But I think that the ability, when I think about the future and what's going to be important for public health leaders in the future, beyond understanding the basics of health, beyond understanding epidemiology, beyond understanding social determinants of health, what is going to be the skills that make the difference between whether or not public health remains a siloed sector or becomes a leader that helps the entire country move forward? Well, I think it's going to be our ability to communicate and to convene. We can have the best knowledge and perspective in the world, but if we can't communicate that to the public in a way that helps them understand the importance of investing in health, the importance of getting behind policies that support health, then our influence is really limited at the end of the day. And so we have to not only understand health, but we have to be able to translate what we know into language that the public understands. We have to be able to bring the public together around a shared agenda around health. And that's where the convening piece comes in as well. Because we understand now, more so than we did 10 or 15 years ago, that to truly create a healthy country, to change both environment and structure as well as culture, we need the engagement of sectors that haven't traditionally thought of themselves as being related to health: transportation and housing and education, all sectors which we know as public health people are important for health. But what we have to do is we have to get all of these sectors to recognize the role they play in determining whether or not our country is healthy. And so the question is, who's going to help sectors understand that? Who's going to speak, for example, with the director of a Department of Transportation and help them see that transportation can have a profound impact on health, and that health needs to be part and parcel of what is assessed when designing transportation policies? Who's going to do that? Well, I think that should be the role of public health leaders. And so the ability to both communicate to the public about health and bring them together around a unified agenda, as well as the ability to convene diverse sectors, both in the public and private space, around a shared agenda around health, these are two critical skills that we need public health leaders to have. And if we can equip our leaders, our next generation of public health leaders with these skills, then public health can become more than just one of many sectors in the country. But it can become a leading force that can help shape how we rebuild our country and how we plan for the future. And that's ultimately what I want to see.
That's fantastic. We have time for, I think, 2 more questions. And so my next question builds nicely off of what you were just talking about and your hopes for the future. And some of our students are interested in your perspective that as future public health professionals and in support of APHA's mission of creating the healthiest nation in one generation, what advice would you offer the next generation of public health leaders in terms of where they should devote their time and their attention and their skill, particularly with an eye towards students who are just at the beginning of their public health journey in many cases?
Well, this is a great question, and I'm so happy that students are asking this question. The most important thing I could tell you is that while you might still be in the middle of your training, while you might still think I have years and years to go before I have all the skills I need, it's essential that you understand and recognize that you have the power to create change in your communities right now, just with the skills that you have. And it's important that you not wait to not only think about, but to actually act on ways of creating change and improving health in your community. But how you go about doing that is important. And I would say that as you're thinking about what lane you want to pick, as you're thinking about what kind of project do I want to get involved with, what kind of issue do I want to address, it's important to think about what is really happening in communities. Now, you can learn a certain amount by reading books. You can read articles. You can read journal papers. You can do all kinds of things to gather information. That's important. You should do that. But there is no substitute for actually going out into a community and talking to people who are impacted by the problems that you're thinking about, that you're reading about, that you're studying in the classroom. And this is what I would encourage you to do. It's something that I try to do as often as I can in this job. Because as I said in the beginning, while I can sit and read as many documents as I want, while I can ask experts from around the country to brief me on topics, and while I do that, and a lot of that is helpful, there is no substitute to me actually going into a community and talking directly with a family, understanding what they're going through. And this, I experience this very often in this job. Just a couple months ago, I was in Flint, Michigan, and many of you know the crisis that Flint is dealing with the water supply, and it's really a tragic situation, and a lot of people are suffering sadly, as a result of the contamination that they have had in the water. And while there are plenty to read about that, in the newspapers and in terms of briefings, it was only when I went there and sat with families. It was only when I went door to door and visited people and saw what their homes were like, saw that their living rooms were filled with water bottles, so much so that they didn't even have a place to sit. It was only when I actually saw brown, dirty water coming out of somebody's tap and filling a bottle and saw the reaction on their face. It was only then that I could appreciate the full depth of the problem and understand it not just here, but understand it here as well. And that's ultimately, as public health leaders, what we have to do, is we have to be able to combine an intellectual understanding of a problem with a humanitarian understanding of a problem, and then help the rest of the country do the same. So I would say to those of you out there who recognize that you have the power to create change right now, I would encourage you to engage with people directly in your community who are impacted by some of the problems you're interested in. Understand what their experience is like. Understand what their barriers are to actually getting care and getting help. Understand what the structural barriers are that they're facing, whether that's safety in their neighborhood or whether it's challenges in their schools. And then based on that direct understanding of the public health problems that communities are facing, think about what really inspires you. And one of the things that concerns me sometimes about student audiences when I talk to them is I find that sometimes, especially among high achieving folks, and I would count the folks who are tuned into this call as part of that group, sometimes there's a tendency to over-calculate or over-plan. Sometimes we think, well, what do I need to do next so I can set myself up for the next steps so that in 5 years I can be in this position, and in 10 years I can be a tenured professor at ABC University, or as somebody who's working in this position in the government, or whatever it might be. But I will say that in retrospect, when I look at my own life, and also when I talk to other people who have lived fulfilling lives, you find very similar stories emerge, which is people say whether or not they planned 5 and 10 years ahead or not, usually what mattered most was the next step. And what matters most is figuring out what you can do right now that will be fulfilling, that will be meaningful, and that will be engaging and fun for you. Because the truth is that many of us who are on this call are incredibly privileged, right? We have more opportunities available to us than 99% of the world's population. And the question is, what do we want to do with that opportunity? And I would argue that the way that you're going to make the greatest contribution to the world is by working on issues that unleash your passion and your creativity. If you're working on an issue because it makes sense, you're going to do a decent job. If you're working on an issue that truly inspires you, you're going to change the world. And that's the calculus here. That's why it's worth taking time to figure out what inspires you. And it's not always easy. Look, I know this from personal experience. When I finished my residency training, I actually didn't know what I wanted to do next. I knew that I loved clinical medicine. That was there. I knew that I wanted to work with a small group of inspired people to create change in the world. But beyond that, I was short on specifics. So I had to make a decision at the end of residency, like, do I just jump into a full-time job and, maybe I'll kind of figure it out on the way, or what do I do? And I decided to actually work part-time at the hospital, and teach at the medical school, and keep the other part of my time free so that I could actually explore ideas. I could go into communities. I could understand what people were experiencing and think about what it was that really grabbed me, what really inspired me. Now, that wasn't necessarily an easy period because half my family, frankly, thought I was partially unemployed. And I was partially actually employed, so I guess I was partially unemployed. But they were worried about me because they thought maybe I was, falling off the deep end or going off track, and maybe I would never be able to get a real full-time job again. I'm happy to say I finally have a full-time job again. So. But the truth is that time was invaluable because what it helped me do was to really understand what it was that inspired me. And it was only after a year of searching and trying a whole bunch of different ideas, many of which failed, that I finally came upon the idea of building my technology company to accelerate research in clinical trials. And that was very exciting to me at the time. But it also solidified for me this importance of pursuing things that you're inspired in. So I would leave you, with that, in terms of a message to think about for the future, because I really do believe that our greatest challenge often as healthcare professionals and as public health leaders is that, especially in our early years during our training, is that we underestimate how much change we're capable of creating in the world. So what matters more than anything else, I think, is understanding what inspires you, what excites you, because that's ultimately what you need to pursue.
Thank you. That in and of itself was, I think, very inspiring. And as somebody who is not as seasoned and not as experienced as you are, I will echo what you said to students who are, still younger than me and coming up behind me, and that this is sort of the time now that you can really do that in a safe way. You have a lot of support and faculty and friends and family and other students to support you. So I think that's incredibly inspiring and very meaningful to me personally, and also I think to many of the students on the call. So thank you for that. So in light of that inspiration, from your perspective, what has been one achievement since you've become Surgeon General that you are really proud of?
Well, that's a great question. I'll be very honest with you. There are times when I go home and my wife Alice will tell you this, but sometimes we'll sit with her and I'll say, God, I feel like we're not making as much impact as we should be making. There's so much more we could be doing, should be doing, and I get worried about that. And she always tells me something very important. She says, Vivek, in your haste to always think about what you should be doing, you forget what you and your team are doing and what you're accomplishing. And the reason I mention this is, one, because, I want you to know that this is something that's at every level, like in life, is important for us to remember, is what's actually working. Because I think many of us, and my guess would be many people on this call, have a tendency to be really hard on yourself and to not recognize the things that you're doing well, the success that you're having, the impact that you're making. When I look back on the last year and the work that our office has done, I feel really proud of our team. I feel we've been able to do a number of things internally by just in terms of infrastructure, building an incredibly diverse team with a new set of ideas that's able to think about the Office of the Surgeon General in a new way. We've been able, for example, to do two things that were a high priority for me in terms of approach, which is to modernize how this office communicates, and also to go beyond communicating and to recognize that in 2016, to really be a positive force for public health, the Surgeon General's office has to do more than share information, but we have to go beyond that and work directly with communities to translate that information into real change. And I've been proud that we've been able to do that in a number of areas. For example, with our call to action that we issued on walking and walkable communities last year with a goal of rebuilding a culture of physical activity in America. And we were able to not only bring information to the community about the positive health impact of walking, but we were also able to work directly with communities to build walking programs to help them think about how to make their communities more walkable, recognizing that 3 out of 10 people in this country above the age of 16 don't even have sidewalks in their neighborhood. It's not so easy for everyone to walk. And many people don't realize that something as simple as walking can be a powerful tool for improving health. If you walk on average 22 minutes a day briskly, you can reduce your risk of diabetes by 30%. You can reduce your risk of sudden cardiac death by 20%. And I guarantee you, if I had a pill that did that, I would do pretty well. But people don't recognize the powerful impact that walking has, and especially at a time when health equity is such an important value for our office and for the country. It's important that we find simple, affordable, accessible tools that can help people improve their health and that can contribute to building a culture of prevention, which is what we need in America. So I'm very proud of of the work we've done to modernize how we communicate and the work we've done to reach out to communities. But the thing I'm really most proud of is the number of people and communities that we've connected with across America during our first year. This was one of the things I started with, was beginning with the listening tour, because I had all kinds of ideas in my head of what I wanted to do. But I really wanted to hear from the community about what they needed, and I knew that was going to inform what we did. And so over the last year, we have visited over half the states in the country. We have visited tens of thousands of people, at this point maybe even hundreds of thousands of people in their communities. We have reached through social media and other channels millions and millions of people, and it has been bi-directional as well, because we've used those opportunities to meet face-to-face and those opportunities online to also gather ideas from people and to engage them in a dialogue about health. And that has been incredibly illuminating. I will say, if you asked me before I became Surgeon General, was I planning to focus on addiction and emotional well-being during 2016? I couldn't have told you that, because that evolved in part from the conversations we had, from the things that we learned this year. I could have told you that those are incredibly important issues, but this is what I think this is what I think our government needs to do more of, is to be responsive to the real needs of people on the ground. That's what we've tried to do. In my office, we clearly have a lot more that we can do and that we want to do. But I want us to keep building that connection between our office and the American people, because part of my goal is to make sure that when people say that the Surgeon General is America's doctor, that actually means something real to them. That it's not just a title, that it's not just a label. It's not that I'm not just the guy on the box of cigarettes or the box of alcohol. But I want people to feel that this office, whether I'm in it or someone else is in it, is occupied by somebody who cares about their health, who understands the challenges they're facing, and who wants to be a partner with them in solving those challenges. That's what we have to build and strengthen in our office, and I think we're well on our way to doing that, and I'm excited to keep working on that over the next two and a half years.
Thank you so much. So we did have one question from the audience that I think will be our concluding question, and I think it does relate some to many of the themes that you've been talking about. Kayla Albrecht from Austin Regional Campus at the University of Texas School of Public Health asked, what are your thoughts on promoting a plant-based diet in the United States?
Well, that's a great question. Well, first of all, let me just say I had a great time when I was at UT Austin just about a month ago or so. So it's great to get a question from that campus. There's been a lot written about plant-based diets recently, and we know that there are documented health benefits of a plant-based diet. I myself, primarily eat a plant-based diet. I eat fish from time to time, but otherwise have primarily a plant-based diet. And I think that there are good health benefits for it. We know that overall that there are different types of diets in the United States that are driven partly by culture as well, and we have to be sensitive to that. What we saw in the dietary guidelines that were issued earlier this year was an emphasis on the importance of culturally appropriate diets as well, of ensuring that people are able to eat foods that they are familiar with, that they grew up with, that are consistent with their cultural practices and beliefs. But with that said, the benefits of plant-based food and dishes and a plant-based diet, that's been established, and it's something that we should promote more of. And so that's why when we go on the road, one of the things that we talk about a lot is the importance of infusing more fruits and vegetables into our diet. We recognize that there are many people who barely get fruits and vegetables in their diet, and they lose a lot of the health benefits thereof. So that's definitely something that we have to promote. Sometimes people wonder, sometimes people ask me the question. It's interesting because I primarily eat a vegetarian diet. They ask me, do I think the whole country should be vegetarian? And I say, no, not necessarily the case. You know, like everyone has their own beliefs, they have their own practices, and you can eat meat and still lead a healthy life and still have a healthy diet. So meat has a place in many people's diets, and that's okay. But what we have to recognize is that we have a deficit when it comes to plant-based sources, specifically fruits and vegetables, and that's something that we have to correct. And we know, and the data on this is so interesting. It's like, and this is like not something new. We've known that fruits and vegetables are incredibly beneficial for a long time. We've known, for example, that for each additional serving of fruits and vegetables, you can actually reduce the risk of diabetes and heart disease by somewhere in the order of 4 to 5%. And that can accumulate with more fruits and vegetables. So there are benefits. The real question is, how do we actually make that happen? How do we bring more plant-based products and fruits and vegetables into people's diet? And that's an issue of cost for some people. It's an issue of access for others who are living in food deserts. And it's also an issue of taste and preference. Because the truth is, we have culturally brought up people to believe that fruits and vegetables are distasteful, that they're the things that you eat because you have to. Because if you don't, then you'll probably get a heart attack in 30 years and die. So what do people do? Well, okay, they'll hold their noses and they'll eat fruits and vegetables. But we have to shift that. We have to create options for consuming plant-based meals and plant-based diets that are actually tasty and appealing. And if we can do that, then we don't always have to use this proverbial stick to move people towards healthier diets, but we can use a carrot. No pun intended, and that carrot should be really foods that are both healthy and tasty. So that's actually something we've been talking to restaurant owners about and to chefs. And there are many actually that we've met recently who are very interested in seeing how they can use their restaurants as a force for introducing healthy and tasty foods into the American diet. And that's the avenue I think if we push on more will help us ultimately shift our diet to a healthier pattern.
Great, thank you. And thank you, Kayla, for that question. And so this will be my last question, and then if you have any closing thoughts that you'd like to share with the students, that would be great as well. Despite many of the best efforts of public health, there are considerable disparities, many of which you brought up today, in terms of health outcomes. How do we address those disparities in a meaningful way and really move toward true health equity?
Well, I'm glad you brought this question up, because health equity is such an important topic to discuss, but it's also an important value that we have to hold in everything that we do now in public health. There are two values that guide us in our office, and to me, those values are prevention, the importance of building a culture of prevention in America at a time where we are almost exclusively focused on treatment. And many of you know better than anyone else that the lion's share of our investment as a country goes in investing on the treatment side. For that reason, we have some of the best treatments in the world, but we do very little on the prevention side, and that's something that has to change. But the second value is around health equity, ensuring that the benefits of treatment and prevention accrue to all parts of the population, not just based on those who live in the right neighborhoods or who happen to have the right skin color or be in the right socioeconomic strata. We have to make sure that everybody is accessing the benefits of treatment and prevention. To me, this is actually important as a value statement, because as a country, we're a nation that has built itself on the promise of opportunity for everyone. We have built ourselves on this idea that if you come to America, that this is a place where, regardless of where you're from or what you look like or what you sound like, opportunity will be available to you. Well, it turns out that health is really the key to opportunity, because if you're robbed of your health, you're robbed of education. Often it puts you at a disadvantage in terms of work. And I have met so many people over the years who lament the fact that their children are dealing with disease earlier and earlier in life, and that is cutting off opportunities for them, whether it's to participate in sports or whether it's to engage in a meaningful way in school. So health is really the key to opportunity. Opportunity must be available to everyone. That is a promise of America, and so I see health as being central to fulfilling the promise of America. Now, what is that? How do we actually do that? Well, I think the first way we do that is we have to ensure that health equity is a value that we hold up as a value that's important. And that seems very basic, and it seems obvious when you talk about it in public health circles, but it's not so obvious outside public health circles. When I go outside public health circles, I don't find a whole lot of people talking about health equity. Frankly, I'm not sure a whole lot of people know what health equity even means outside of public health circles. So that's something we have to recognize. And this is sometimes a trap, I feel like, for those of us in public health, because we assume that the ideas that we talk about all the time are relatively common sense and understood on the outside, and that's just not always the case, and health equity is one of those examples. But we have to go beyond holding it up as a value in theory, but we have to make sure that that value is reflected in our education and how we, for example, train doctors and nurses and public health professionals. We have to make sure health equity is reflected in our research and what we choose to study. And we have to make sure it's reflected in our policies. Whenever people put together policy proposals, they always score the cost. Right? That's become a routine, that money is important, cost is important, it should be a factor we consider when we design policy. We should be thinking the same way about the health impact of policies. And in that lens, health equity is a key outcome that we have to measure as well. Does this policy contribute to health equity, or does it detract from our efforts to create an equitable health infrastructure and health system for everyone? So the question again is, who's going to ensure that health equity is a value that's held up? Who's going to ensure that it's infused in our education, in our research, in our policy agendas? Well, that's where public health leaders come in. That's where your ability to communicate and to convene as public health leaders is what will make the difference between ideas like health equity remaining siloed in the world of public health and actually being a value that is dispersed and felt and practiced throughout our country. So this is why I'm so optimistic and hopeful about the public health, or the world of public health, but also the leaders who are training today. Because I think that we have an incredible opportunity in front of us to be leaders for the country at a time where the country really needs it. We have the chance to be translators and help people see that the health impacts that they and their communities may be feeling are actually being felt by the entire country and are a source of unity. And we have the ability to bring the country around a public health agenda, which, if successful, would not only improve health outcomes and reduce disease rates, but would contribute to greater productivity in our country, would improve our sense of self and our confidence and our belief that we are a country that is strong and that can do anything. Because the truth is, a country that is riddled with disease is not a country that is strong. And a country that's not strong is not a country that can go out and innovate and do great things in the world and provide leadership. So that's what we can change as public health leaders for our country. And that's why I'm so optimistic about the future of public health.
Well, Dr. Murthy, thank you so much. And your presentation today was certainly inspiring and very meaningful to, I'm sure, not only myself and Suparna, but we have over 70 sites who've joined us today, and I'm sure that everyone who has participated has found this to be incredibly meaningful and inspiring. So thank you so much for taking the time to talk to the students and the members of APHA.
Well, thank you so much for having me, and I just wanted to the students in particular to say thank you for not only joining, but thanks for your interest in public health and for committing to this profession. This is a great time to be in public health, and I'm very excited to see what all of you do in the years to come.
Thank you so much. And so, Suparna, I'll turn it over to you to take us out, and thank all of you for joining us today on this very interesting and inspiring talk.
Thank you, Tamar and Dr. Murthy, and to all the students who submitted questions for today's conversation. I hope you're all feeling inspired as public health students and future public health professionals to go out and actually create that change that Dr. Murthy was speaking about, and to help direct and advance the future of public health. If you have the opportunity to explore the community you wish to work in, I encourage you to do that and to also share that with the Student Assembly and APHA. This is an incredible time to be in public health, and I believe we are all Generation Public Health and can create the healthiest nation by 2030. Finally, if you're not a current APHA member, I encourage you to join so you can continue the conversation from this afternoon and to meet other like-minded students and public health professionals. Additionally, please make sure to like and follow APHA Student Assembly on Facebook and Twitter to share your story and for updates on ways to get involved. Thank you all for joining us today, and have a great rest of National Public Health Week.